honorable participants, my dear colleagues, ambassadors, and also Professor Aysun Bey, whom I have the pleasure to know for the last 3 years. And I really want to thank her for her dedication and efforts to promote this health tourism in Turkey for a long time. And I think I am the only ambassador here now today that who attended your previous summit as well in Izmir. Before starting, I would also like to thank my elder brother from Pakistan, who has actually underlined a very important point that health should not be commercialized, right? We are talking about tourism, but it's from a different perspective. Health is also a right for us as well. And I don't want to miss thanking the 2 keynote speakers. Your presentations were really interesting, very much interesting, and I really liked that point of it pointing the 2 fingers. I tried to concentrate, but I was not sure whether to look at the fingers or to look at you. So that was a different issue. Anyways, to get into the topic is health tourism has now become one of the fastest growing global service sectors. Every year, millions of people travel abroad seeking better medical treatment, advanced technologies, specialized doctors, and improved healthcare experiences. South Asia, with its huge population and rapidly growing middle class, has become one of the major sources of outbound medical tourists. And in this regard, Bangladesh represents a significant example. Every single day, thousands of South Asian patients travel abroad for treatment, particularly to countries such as Singapore, Thailand, India, and increasingly Turkey. This trend continues to grow steadily. If we try to find out the reasons, there are mainly 2 important reasons behind this phenomenon. First, in many South Asian countries, including Bangladesh, there remains a shortage of highly modernized and specialized treatment facilities in certain sectors. While healthcare systems are improving, integrated patient management services are still limited in some areas. Secondly, and perhaps even more importantly, there exists a matter of public trust and confidence. Sometimes the treatment itself may actually be available in the home country. Skilled doctors may also be present. However, many patients and families still believe they will receive more reliable, better organized, and higher quality treatment abroad. This perception strongly influences medical travel decisions. And in this connection, Turkey has emerged as a remarkable success story. Over the last 2 decades, Turkey has transformed its healthcare sector through visionary investments, technological modernization, hospital infrastructure development, digital health systems, highly qualified medical professionals, affordable treatment costs, and internationally competitive healthcare services. I would like to underline one particularly important factor that sometimes we underestimate a little bit, that patients do not seek only treatment. They seek care, comfort, empathy, professionalism, and dignity. In many cases, the patient experience itself becomes equally important as the treatment. Turkey has been highly successful in combining medical excellence with hospitality and patient care services. There exists enormous potential for deeper cooperation between South Asian countries, especially Bangladesh and Turkey, in this health tourism sector. Possible areas of cooperation, if you allow me to identify some of them, would be hospital partnerships, doctor and nurse training, medical technology exchange, joint healthcare investment, telemedicine cooperation, pharmaceutical collaboration, rehabilitation services, and last but not the least, patient referral systems. Bangladesh, with its population of more than 180 million people and rapidly growing middle class, can become an important partner for Turkey in this sector. Furthermore, direct institutional collaboration between Bangladesh and Turkish hospitals can significantly increase confidence among patients and facilitate smoother medical travel arrangements. Ladies and gentlemen, health tourism is not only an economic opportunity, it is also a bridge of humanity, trust, and international cooperation. I strongly believe that cooperation in the healthcare and health tourism sectors can become another important pillar of this growing partnership between Bangladesh and Turkey. And before conclusion, I would also like to thank Professor Aisunbe and the organizers for the hospitality and bringing us all together in this beautiful city of Antalya with this fantastic weather outside. Thank you very much. Teşekkür ederim.